throughout all the body. It can be used for listening to your lungs, and it can be used for listening to your heart. This is a blood pressure cuff. It is used to measure your blood pressure. These are just a few of the tools that nurses use every day. Hello, my name is Kirstin, and for my career, I chose to be a nurse practitioner. My job objective is to obtain a nurse practitioner job. My opportunity cost is becoming a psychiatrist. An opportunity cost is pursuing a particular course of action instead of an equally appealing alternative. My top 3 career choices were to be a nurse practitioner, a psychiatrist, or to be a paramedic. The reason I chose a nurse practitioner for my career was because I have always wanted to help people heal and get better. A nurse practitioner is an advanced practice registered nurse. As a nurse practitioner, I will be working my hardest to make sure my patients heal correctly. A nurse practitioner can prescribe medicine and educate their patients. My first image is one of the nurse's jobs and is an IV and is used to get more fluid or medicine into a person's body. My positive incentives for becoming a nurse practitioner are that I get to 1. Help relieve pain from injured people. 2. There is a good salary. And 3. If I ever wanted to choose a different profession, it would be a little easier because we have all the degrees I have gotten. My negative incentives for becoming a nurse practitioner are that if something goes wrong, there's a possibility of a lawsuit from the family. A patient could die right in front of you, or there's always a possibility of getting sick from one of your patients. The trade-offs that I made are that I gave up having pets so that I could have more miscellaneous money. I got more money for food because I gave up some money from my savings, and I put money into my food budget and my clothing budget. In my second picture, it shows what happens when someone has a trauma accident and needs a heavier treatment. This is my resume. To become a nurse practitioner, I will need to go to college to get an associate's degree, a bachelor's degree, and a master's degree. Oh, you can do that. I attended Heston College in Heston, Kansas for my associate's degree. After that, I will go to Washburn University in Topeka, Kansas for my bachelor's degree and also for my master's degree. A few important skills that are needed to be a nurse practitioner is that I need to be flexible with my schedule and good with people. One of my 2 references that I put onto my resume were Molly Jane, the top paramedic at Heston Fire and Ambulance Department. My other reference was Mary Smith, one of my co-workers at the Heston doctor's office. This is my letter of application that I wrote to Susan Schmidt, the CEO of Future Metropolitan in Montreal, Quebec. I applied for one of the nurse practitioner job openings. I found these job openings on a job search site. I put a few of my past jobs, my skills, and my qualifications. My yearly salary is $67,000, and my monthly budget is $5,583.32. In my budget, I have $683.50 for housing per month. This includes my rent and my renter's insurance. I spend $783.95 on transportation, which includes my car payments and my auto tax. $225 in my budget goes towards my utilities and gas and electric. For my budget, $1,637.46 goes towards taxes like the federal income tax and the state income taxes. For food, I am putting $170 towards that, and I will be going grocery shopping every couple of weeks. I'm using $450 for medical insurance. I'm putting $150 into my school loans per month. $38 of my budget will be used for toiletries. $1,498 of my budget will go towards discretionary, which includes things such as clothes, charity, and savings. This is my pie graph. It shows that what percentages of my monthly budget is going there. For housing, I need 12% of my monthly budget. I am using 5% for my transportation and 4% for my utilities. 29% of my budget will be going towards my taxes. For my budget, only 3% was used for food. For medical insurance, I'm using 8% of my budget, and for school loans, I'm using 3%. I'm using 1% of my budget to buy toiletries, and 35% of my budget goes to my discretionary. My third picture it shows a nurse either before or after dealing with a sick person or helping out in an operation, and shows them in their toilet. The websites that I used were bestnursingdegree.com. I got the information about degrees I will need to become a nurse practitioner from this website. Collegegrad.com is where I found out what a nurse's jobs are. I found the website I found my colleges that I would go to were allnursingschools.com, and the websites that I got my articles from were mightynurse.com, and this article was about some of the positive incentives of becoming a nurse at any time. And my second was nursingleague.com, nursingleague.monster.com. And I found my second article on this website, and the article is about how nurses have been able to get hands-on trauma training. Donna Wilk-Perilo once said, "When I think about all the patients and their loved ones that I've worked with over the years, I know most of them don't remember me, nor I them. But I do know that I gave a little piece of myself to each of them, and they to me. And those threads make a beautiful tapestry in my mind that is my career in